Well, hello everyone, and welcome to this continuing professional development lecture entitled Drought in the Northern Pacific, Potential Public Health Impacts. Many of you know me already. My name is Professor Brian Mangum. For those who might be new to my CPD lecture series, I'll go ahead and give a quick introduction to who I am and what I do. As I said, my name is Brian Mangum, and I'm a consultant epidemiologist, and I'm also an assistant professor of epidemiology and biostatistics within the College of Medicine, Nursing, and Health Sciences at Fiji National University. I am also, at least for the next 3 years, an assistant professor of epidemiology and public health in the Division of Health Sciences at the College of Micronesia in the Federated States of Micronesia, where I have been placed by the Pacific Island Health Officers Association in conjunction with a grant with the Zuckerman College of Public Health at the University of Arizona to provide these continuing professional development lectures to the existing public health, medical, dental, nursing, and so on and so forth workforce that is working in areas related to public health here in the Pacific. So today what we're going to be talking about is an issue that's rather current. As you notice by the date in the lower left-hand corner there, it's the 7th of February 2016. So we're very early into 2016. And we're going to be talking about the current drought that is sweeping across Micronesia and the Northern Pacific, and in particular across the United States affiliated Pacific Islands. And so it's a contemporary issue. It's something that's going on right now. But I want to point out that drought is nothing new here in the Pacific, all right? A lot of people think of us as this wet area, and indeed we are. We're surrounded constantly by water. But because of a variety of issues related to El Nino and La Nina, as well as ongoing issues related to climate change and globalization and economic impacts around the globe, we are faced with things such as drought, all right? We're faced with climate change, climatic events such as drought and cyclones and hurricanes and so on and so forth, okay? So these are nothing new to us, all right? But it is a contemporary issue, like I mentioned, in the fact that we're currently experiencing one of the more severe El Nino cycles in recorded history, and so that means we're experiencing a drought here in the Northern Pacific. So we're going to talk about that. But I want to point out that much of what we're going to talk about today is applicable not just to climatic cycles like El Nino and La Nina in terms of emergency preparedness for drought, but are also highly relevant to the issue of climate change in areas like the Marshall Islands, as well as down south in areas like Kiribati, where climate change is essentially erasing islands and erasing cultures that have existed for thousands of years. So what we talk about today is applicable not only just in terms of the current drought cycle, but also in terms of just the larger issue of climate change that we're experiencing out here. All right, so let's go ahead and just jump right in here. So we are experiencing worsening drought conditions here in the Pacific, as I mentioned just a moment ago. We are actually experiencing one of the strongest El Nino seasons that we have on record. Now, if you remember your basic science, you probably remember that El Nino is simply a period of warm ocean surface temperatures, and that results in decreased rainfall. Okay. Now, the other half of El Nino is La Nina, okay? And La Nina simply means a period of cool ocean surface temperatures that result in increased rainfall. And I'll mention La Nina and its importance here in just a minute. Now, I want to point out, like I mentioned in the introductory slide, that this is part of the normal climatic cycle, okay? I am not suggesting that climate change is not occurring. There is good science to suggest that climate change is having a significant impact. And in fact, you and I who live out here in the Pacific, we see the impact of climate change. Like I've said, I mentioned the Marshall Islands, where climate change is having a daily impact in terms of tide cycles, or we could think of places like Kiribati in the southern hemisphere, Christmas Island in the southern hemisphere, where we're actually seeing the islands disappearing, all right? We're seeing that climate change is causing ocean levels to rise, okay? So that is real, that exists, and that exists, and that is an ongoing problem that we have out here. But in terms of what we're discussing today, we're talking about the current drought from the standpoint of an El Nino, which is a normal climate cycle that we would expect to see. Okay, and like I said, this is probably one of the worst El Ninos that we have on recorded history, and so consequently, we've had this ongoing period of decreased rainfall and hence a drought. Okay. Now, what does this mean? Well, we're currently in most of the USAPI, we're experiencing a moderate to severe drought conditions. And we rank drought conditions on a scale of 1 to 4, okay, with 4 being the worst, 1 being almost non existent. We're currently at a level 2 across most of Micronesia, and that includes Guam, the Northern Mariana Islands, the Republic of Palau, Republic of the Marshall Islands, and in particular here in the FSM in Yap and in Chuuk. Chuuk is experiencing significant drought conditions in many of its areas. Here in Pompeii, where I'm currently located, we are experiencing below normal rainfall, but we wouldn't necessarily classify ourselves in a drought condition at this point. Now, what do we expect in terms of the worsening drought conditions? Well, we're hoping that as it continues across the first half of 2016, that we're going to see some relief as we get into the later half, the later quarter of the 2016 year, and we're going to see ourselves transition into La Nina, which is essentially El Nino's little sister. Okay, and when we transition into that, we're going to see cool ocean temperatures, increased rainfall, and etc. Okay, but what you're going to see is that there's this direct connection. Well, you probably are thinking, well, that's good news. So as we approach the end of 2016, we're going to see the end of the drought conditions, and that is good news, from an economic and an agricultural standpoint. But what we are going to see as we continue our discussion here is that we transition from an El Nino or a drought condition into a La Nina or increased wet conditions. We're going to see that that's going to bring problems with it as well. It's going to bring problems like saturation of the soil leading to landslides and so on and so forth, as well as some problems with the availability of groundwater, because what we'll see is that when we've had significantly dry periods of time, that a lot of chemicals get concentrated in the soils, and then when the rains return, those chemicals that are concentrated in the soils are brought out in the rainwater, they're brought out in the soil, and they go into the rivers, they go into our catchments, they go into our places where we store water, and consequently that can result in its own environmental health conditions as well. But we'll talk about that just a little bit more later in the lecture. So, what is the impact of all of this? Now, there's a wonderful report that has been released by the U.S. Weather Agency, NOAA, the National Oceanographic and Atmospheric Administration, that's making specific predictions for different islands across the USAPI. So, that's a wonderful resource you can go out and you can find to look at specific predictions for your own jurisdiction. But just in terms of a general summary of impact across all of the USAPI, obviously, because we're in a drought, we're seeing below average rainfall, and the result of that is we're seeing a drying and yellowing of the food crops that we've traditionally relied upon, as well as a drying and yellowing of the vegetation. Now, you're fully aware of the fact that we're highly reliant out here on outside food sources, okay? Much of what we eat and much of what we consume is shipborne. It's brought in from outside, and so that's economically at higher prices. And we do, though, have a small percentage of reliance on locally produced food sources, particularly in the outer islands, okay? So the problem is when we see this drying and yellowing and gradual decay of our locally produced vegetables and fruits and food sources, then that's going to have a significant economic as well as nutritional impact upon the populations. All right, and like I said, this is in particular in our outlying islands where we see a limited supply chain in terms of food going out to these places. Okay, so what is this going to do? Well, it's going to have a couple of issues with the drying of the vegetation from just a large scale issue. We're going to see an increased potential for grass fires, which are common in places such as the Commonwealth of the Northern Mariana Islands, which is where I was working earlier in 2015. I saw a number of grass fires there. I've even seen some grass fires here in Pompeii where we're not having significant drought conditions, and I know grass fires have been an issue in places like Guam as well. So as we enter these drought conditions, grass fires become a problem. That becomes an issue in terms of its environmental impact as well as the impact on locally produced food sources as well. But in terms of specific public health threats, when we see drought conditions, we're going to see some nutritional related disorders that are going to become increasingly problematic. And we'll go through these individually in a minute, but I just want to mention them here. Malnutrition becomes a problem, all right? So people don't have access to the appropriate foods, especially in those areas where there's heavy reliance on locally produced root crops, vegetables, things along those lines. Okay, we also see micronutrient malnutrition. Now, micronutrients a little bit different because now we're talking about things like vitamin A, vitamin C, things along those lines that become an issue in our populations as well. Okay, we'll talk about that more in a minute. And then we also see what we call anti-nutrient consumption. And this hasn't necessarily been a problem here in the Pacific. We see this in areas like Southeast Asia and in particular sub-Saharan Africa. And as food sources become depleted, people will turn to alternative food sources. They'll use local grasses, or they won't process foods quite as well, like cassava. For example, we have a number of cases in Mozambique and Tanzania where we had people eating local grasses, and we also had people not properly processing the cassava or the tapioca, and that resulted in some problems there. So we'll talk about that anti-nutrient consumption here in a minute. Obviously, we're going to talk about some of the water-related diseases, and you're asking yourself already, water-related diseases, but we're talking about a drought. Well, what we're going to talk about in particular with water-related diseases and vector-borne diseases is that as we see droughts come to an end, all right, so as we predict ourselves transitioning into a La Nina cycle later in the year, is that we almost always see an uptake in the vector-borne diseases like malaria, dengue, chikungunya, Ross River fever, and things like that. So we'll talk about the connection between drought, rainfall, vector-borne diseases, and emergency preparedness, being prepared in terms of healthcare systems and public health systems for the return of vector-borne diseases in increased numbers following droughts later in the presentation. And then we're also going to talk about the threat of mental health issues like depression, alcohol abuse, substance abuse, abuse within the home that are also associated with the economic and personal stressors that come with living in a drought-impacted zone. So all of this leads into this idea of emergency preparedness, or what we sometimes call disaster risk management, okay? And we in public health and we in medicine are particularly well prepared to look at things like drought from the standpoint of preparedness and management, all right? Because much of what public health does is we look at how do we prepare for, how do we mitigate the impact of potential outbreaks, non-communicable disease issues, and so on and so forth, okay? So I do couch it in the language of emergency preparedness, but it's particularly applicable to us in public health because we have such a firm grounding in issues like primary and secondary and tertiary prevention. So what are some of the issues that we need to be aware of, particularly if we are leaders in our organizations, whether those be public health organizations, medical organizations, NGOs, government offices, whatever it happens to be? Well, first of all, we need to be concerned with this idea of water conservation efforts, because what we're going to see in drought conditions is we're going to see increasing depletion of our wells and also the water catchment systems that we have. And as we see those water levels drop, and as we work to conserve water and we educate the public, we need to be concerned with monitoring these water wells, okay? Not only monitoring the dropping in the levels and whether or not we need to be concerned with emergency provision of water and foodstuffs to communities in which water levels are dropping, but we also need to be concerned with the issue of salinity, because here we live on an island in the Pacific, so as our water levels drop in our wells and in our catchment areas, we have the increased capacity for salt water to invade those water systems, okay? And that becomes an environmental epidemiological issue at that point that we need to be aware of in terms of our surveillance and monitoring systems. Now, obviously, as we monitor our water levels, we need to make sure that the communities that we're serving have access to sufficient water for both health as well as hygiene issues. And we'll actually get into hygiene a little bit later on, because there's some really good evidence showing that as droughts progress, hygiene tends to go down, and we actually see increases in communicable diseases in our populations. And it can be simple things like impetigo. As people don't wash their skin and take care of their skin as much, we see increased rates of impetigo presenting into our primary care as well as public health system. So we'll talk about that a little bit later as well. Obviously, we need to monitor our food crop health status. Okay, I mentioned that already. In the Pacific, on our major islands, we have limited reliance on locally produced foodstuffs, but we get out into the outlying islands, what we would call the rural and the frontier areas, we see increased reliance on locally produced crops. And as we see our food crop health decline, then we're going to see an increase in malnutrition disorders, an increased economic stress as people have to rely on foodstuffs that are brought in from outside of their islands. Okay, so that's why I mentioned that internal versus external resources there. So what do we need to do? Well, we need to be, because we are public health, right? We need to be involved in public health education. We need to be involved in increasing the literacy, the health literacy of the general population in terms of what they can be doing to prepare for and respond to droughts. So fire risk reduction, all right? How do we teach people to engage in safe fire practices in terms of their cooking fires so that they can reduce the risk of fires? How do we teach people to conserve water? How do we teach people to monitor the salinity of their own water wells, okay? How do we teach people the signs and symptoms of nutrition and how they can maintain a healthy nutritional status for themselves and their homes, their schools, their workplaces, and so on and so forth during times of drought? And also disease elimination education. How do we teach people the risks of droughts in terms of malnutrition? But also, like I mentioned earlier, how do we teach people the risks of when the water returns? And we see an increased risk of dengue. So how do we teach people to dengue, malaria, so on and so forth? How do we teach people to make sure that they do weekly search and destroy missions around their homes to find mosquito breeding grounds? How do we make sure that they're ensuring that their catchment systems, their water supply systems are tightly capped and screened so that mosquitoes don't get into those areas? That all is tied back into this idea of public health education, and in particular public health education as it revolves around our current drought cycle that we're existing in. So this brings us to our first major topic, or this idea of nutritional disorders and drought that I've already introduced generally. Now we know that the idea of malnutrition just in general does increase during times of drought. That's obvious, okay, because during times of drought we do see increased food security risks, and we've already discussed why that is, particularly in our outlying islands, because we are a resource limited environment, all right, so we do see increased impact, okay? Now we're also going to see that impact that I've mentioned in terms of our local ecosystems, and that can come just from a lack of water for agricultural purposes, for the purpose of making sure that we have enough water to grow food crops such as taro, dalo, cassava, so on and so forth, as well as other things like ensuring that our coconut trees are healthy and so on and so forth, okay? So when we see an impact on our ecosystems, when we see drying of the soil and lack of water to feed these things, we're going to see a reduction in our locally grown food supplies. That in turn creates an economic impact or an economic stressor on our ability of our local populations to take care of themselves without having to rely on high-priced shipborne commodities. So we've already discussed that a little bit more in depth. Now, we're also going to see what I've mentioned is we're going to see micronutrient impacts as well. So as people don't necessarily get the appropriate food that they need within their diet, okay, we're going to see a variety of different things crop up. Okay, we might see iron deficiency anemia, which is already a problem here in the Pacific, become increasingly worse. Okay, we also might see an increase in vitamin A deficiency, all right, leading to night blindness. And these are all things that we have seen throughout the world in Southeast Asia, here in the Pacific, as well as in areas like sub-Saharan Africa and the Americas, where we have the ongoing droughts, and these are the micronutrient impacts that we tend to see. Okay, we also might see a decrease in our vitamin C consumption as we see a decrease in the amount of certain citrus fruits that are available, and that in turn can actually lead into scurvy as well. And I want to point out it's important to remember that when we're talking about general impacts of nutrient disorders associated with droughts, that energy and protein consumption are important. So it's important that we make sure that people get just enough caloric intake throughout the day. All right. So if we have an emergency situation and we're bringing in canned foods, for example, that's good because that increases the amount of energy and protein being consumed by the population. But we also have the concern as to whether or not we're getting enough of the micronutrients. So if we start shipping in canned meat, then it may be that we're going to eliminate the anemia. We're going to make sure that people have enough fat, they have enough protein, but are we making sure that they have vitamin A? We're making sure they have vitamin C associated with those food sources as well. So that's something that you need to be keeping in mind as public health planners. Now, we also have this issue of anti-nutrient consumption that I mentioned briefly. So, when we see a failure of crops, all right, in an area like here in the Pacific, what we do see is that people will turn to other food resources. Now, they might economically be able to turn to food from their local shop, but a lot of times we see them turn to other sources because of economic need, all right? And a lot of times they will start to consume local plants and grasses and things like that are not normally consumed, okay? That in turn results in increased risk of increased risk of potential poisoning, as well as increased risk of diarrheal diseases and so on and so forth. So that's something that we need to be aware of. And then we also see a lot of times we'll see a lack of appropriate processing. I've got a couple of examples of this. One that we see a lot in sub-Saharan Africa is that they will turn to wheat, all right, because wheat may have been stored, but they don't necessarily have the ability to process the wheat that has been stored, okay? And so we get some issues with that. Okay, we don't necessarily rely on wheat out here, and if we do have wheat, it's usually in the form of flour that's been processed. But what we do is we have a lot of root crops out here, and we've also seen a number of problems with the inappropriate use of root crops in drought conditions. And I mentioned earlier, and I'll just talk about it here, a number of studies looked at Tanzania and Mozambique, both countries in Africa, and they found that cassava, which we all know cassava is tapioca, it's something that's commonly used and relied upon out here in the Pacific. What they found was that there was a lack of appropriate processing and preparation of the cassava during drought situations because of a lack of water for boiling and so forth, okay? And what that did was it led to a lot of neurodegenerative diseases because, as you know and I know, if we don't appropriately prepare cassava, it can actually poison us, okay? So we do need to be aware and we do need to educate the public about the potential risks from anti-nutrient consumption as well, and in particular put an emphasis on appropriate processing of available foods and ensuring that populations have access to water for that processing. Okay, so what are some of the other health impacts of these nutritional disorders that can be associated with droughts? Well, it continues to really underpin the growing NCD problem. Okay, we already have discussed in one of my other lectures, and if you haven't watched it, there's one on economic and nutritional shifting, as well as the two on obesity prevention, one in adults and one in children, that I'd recommend you go watch. And so we've already talked in those discussions about the economic impact of locally produced foods. When we have locally produced foods, we have a lower reliance on canned foods, processed foods, high fat foods, high carbohydrate foods that are brought in from the outside world, okay? So here we have this issue of drought. So we take into this issue of drought the idea that we're going to see decreased access to locally produced foods because we're going to see decreased capacity for local farmers to produce cassava, other fruits and vegetables, and so on and so forth. Okay, so we take that in the context of areas of the world like the Pacific where we're already highly reliant on things like turkey tail, spam, rice, and so on and so forth that we're bringing from the outside world, and we remove a chunk of that locally produced produce. Okay, people can't afford to eat the apples that are $7 a bushel or the grapes that are $7 a kilo. Okay, and so all of a sudden they're in a situation where they've had the locally produced foods removed. Okay, the other food that is available is high priced, and so they buy the food that is available that they can afford. They buy the spam, they buy the turkey tail, they buy the processed meats, and so all of this comes back around to further reinforce this idea of NCDs as related to lifestyle choices. Okay. We also have this issue that we know from a wide number of studies out here in the Pacific as well as in the Atlantic Ocean. We know that traditionally El Nino actually reduces the ocean fish stocks that are available, both the deep water fish as well as the fish that are being caught locally all right, closer to islands, and you know those local fish are an economic impact in terms of being sold in local markets, but they're also can have an impact in terms of being good sources of protein. And so when we reduce those good sources of protein and we reduce that economic impact, it further entrenches this idea of NCDs as related to nutritional disorders and droughts. Okay. Now, a lot of the populations that are vulnerable during drought cycles are the populations that are already vulnerable to issues such as non-communicable diseases as well as communicable diseases. So anyone that already has a non-communicable disease, a chronic illness, a cancer, a type 2 diabetes, whatever it happens to be, cardiovascular disease, all things that we're concerned about, a tuberculosis, all things that we're concerned about here in the Pacific, okay, if they already have decreased capacity to fight off illness because of their chronic illness, because of their NCD, then all we're going to see then is that this population is at increased risk for the impacts, the economic impacts, the health security impacts, the food security impacts of a drought situation. Same thing with children, the elderly, pregnant women, okay, these are all populations that are already at risk and are economically and public health at risk in terms of the ongoing crisis of non-communicable diseases here in the Pacific, and so it just reinforces it in these populations as well. And we've already talked about how the outlying islands with limited transportation, limited supply systems are going to be at increased risk as well. And of course, anybody living on these low-level islands, such as we would see in areas like the Republic of the Marshall Islands, where we see increased salinity of their wells and their catchments, they're also at risk of nutritional disorders associated with these droughts. So just a couple more issues associated with water, disease, and drought here. So obviously the availability of water leads to issues with nutrition and hydration, loss of crops, wildfires, all things that we've already talked about just a little bit, okay? But they're also going to lead to loss of soil integrity. So as the soil dries out, okay, over an El Nino cycle or over a climate change cycle, then as we enter into a La Nina cycle, okay, and we see the return of the waters, sometimes we see the return of the waters at extremely heavy levels. We'll see them in terms of cyclones returning. Okay, what happens is the soil has been dried out and essentially it's lost its integrity. Part of the reason it's lost its integrity is because of the crops that would normally grow in it, the naturally occurring weeds and grasses as well as tree roots, because of the drought cycle, those have dried up and they've died. All right, so it's the roots that will sometimes, from the natural grasses, that will hold the soil on the side of a ravine overlooking a village. And so as we see a return of the La Nina and the waters, what happens is that soil becomes rapidly saturated. It's lacking those root systems to hold it in place. And so we'll see increased floods, and we'll see increased risk of landslides. Those are all things that as public health planners we need to be aware of, as emergency planners we should be aware of, but also something that we need to make sure we educate the general population about, because we might have entire villages living in ravines. We might have entire villages living in areas where, as the waters return and we see those landslides and those mudslides occur, they're at significant risk. Now, we also have a lot of studies that have looked at this issue of poor hygiene during droughts, and we know that as droughts come to an end and as the weather cycle returns, that we're going to see an increased risk of diarrheal diseases. Okay, I mentioned earlier in the lecture that comes from a concentration of certain chemicals in the soil during a drought season, and then as the waters return, those chemicals are released into water catchment systems through rivers and streams and so on and so forth, where they're collected and consumed. So there is an association there between diarrheal diseases and the return of the wet season. We also know that we see an increase in skin infections during hygiene or during drought seasons because of poor hygiene. People simply don't have enough water to meet both their food needs and their hygiene needs, okay? And so we see an increased risk of things like scabies, impetigo. We actually have a number of studies out of Asia and sub-Saharan Africa that also show an increased risk of conjunctivitis, as people are not washing their hands and they're coming in contact with certain environmental risk factors. They then touch their eyes and we see an increased risk of conjunctivitis, which can be easily treated if people have access to sufficient sufficient health resources and education about when to seek help. But if they live in an area where they don't have access to health resources, something like conjunctivitis can actually become a debilitating disease for these populations. Okay, and there's also this issue of the quality of water, and I've mentioned a little bit about this already, but I'll just mention something more here. So we have this issue of the wells and the catchment systems. Okay, these can actually be a source of infectious diseases. Okay, especially during dry seasons. Okay, they can also be a source of breeding grounds for mosquitoes. When we look at drought seasons in the Pacific, and when we look at drought seasons elsewhere in the world, what we find is that good education teaches people to start to store water, which is good. All right, we want to store water, we want to preserve water, but the problem is, how are we storing the water? Okay, are we storing it at home? Are we storing it in our workplace in a way that the water does not become a breeding ground, all right, for certain bacteria? Are we storing it in a way that the water doesn't become a breeding ground for mosquitoes to come along? So in other words, do we have mosquito nettings over our water catchment systems? The water that we're storing around the house to feed the tomato plant, all right? Do we make sure that it has some type of a tight cover over it? Because if the mosquitoes get in there, in particularly Aedes aegypti, we worry about the spread of dengue. We worry about the spread of Zika virus, all right, which is currently in Tonga and in Australia and rapidly spreading throughout the Americas and areas of Africa. Okay, so we want to make sure that we store water, we use water appropriately, but we want to make sure that we store it in an appropriate means that it doesn't actually become a source of infectious diseases. Now, I've already mentioned that following long dry periods, chemicals tend to accumulate in the ground, and then these chemicals enter the water supply system when the rains return, and they become consumed, all right, leading to diarrheal diseases, neurodegenerative diseases, and things along those lines. So once again, all things that we in public health and medicine should be aware of, but we should also be educating that public that we serve about these things. Okay, so we're getting close to the end here. This is slide 11 of 13, so we're very close. Let's just really quick talk about vector-borne diseases and drought. Now, dry conditions precede vector-borne disease outbreaks, okay, such as dengue, malaria, chikungunya. There's Zika, the current buzzword in infectious disease epidemiology across the world, and so on and so forth. Okay, how does this happen? All right. Remember, I mentioned earlier in the presentation, you're probably thinking to yourself, well, why do dry conditions give rise to vector-borne diseases? Because we live in the Pacific and we know that vector-borne diseases need mosquitoes and mosquitoes need wet conditions to breed. And how are they breeding during dry periods? Well, the simple answer is they're not. Okay. Now, these mosquitoes are remaining the most important sources of the vector-borne diseases that we see here in the Pacific. So what happens is that mosquito populations tend to increase following drought cycles. Okay, so it isn't that the drought itself is related to or is causing the disease outbreaks with the vector-borne diseases. What it's doing is it's creating conditions in which later down the road we can see a rapid increase in the mosquito population, and in particular Aedes aegypti, all right, which is a significant problem with dengue here in the Pacific. And so what happens is during the re-wetting season, all right, so when we go into the wet season again, such as a La Nina cycle, which we're expecting later here in 2016, we're going to see a recolonization on a rapid scale. Okay. Part of the reason that occurs on a rapid scale is that many of the natural predators of mosquitoes like Aedes aegypti have actually been killed off. So when the rains come back and we get wet areas, and we get mosquito breeding grounds in low-lying areas, the normal predators of these mosquitoes, such as fruit bats, for example, okay, have actually been seen their populations decrease during the drought cycle. So a normal check and balance in the recurrence of mosquitoes in the ecosystem and in the population, and hence a normal recurrence in the rates of vector-borne diseases, is gone. All right, and so we see rapid re-wetting, rapid recolonization of the mosquitoes, and consequently a rapid return to a situation where we see outbreaks of vector-borne diseases like dengue and so on and so forth. So I'm just going to go ahead and use dengue as an example to talk about what we're discussing here. Like I said, I've already mentioned there's a wide variety of others that we could discuss this from the standpoint of malaria or chikungunya, or like I said, even Zika, which is becoming the current buzzword. Maybe I'll have to do a quick continuous professional development lecture on Zika since it's the cool thing right now. Okay, but let's stick with dengue because it's long present here in the Pacific area. Okay, so as you know, as you can see the picture there off to the side, there's our buddy Aedes aegypti, the type of mosquito that tends to spread dengue. When is it active? You should know this already. It's active in the morning and in the evenings, and so on and so forth. And we all know the standard public health precautions: screens on windows eliminate mosquito breeding grounds, weekly search and destroy your property, cleaning up rubbish, blah, 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 things along those lines, okay? But we need to be educating people a little bit more during a drought cycle because they tend to not be thinking about vector-borne diseases because it's dry outside, but we've already discussed how later this year, when La Nina comes along and we see a sudden return of the wet season, we need to have people already thinking about how can they be protecting themselves, their families, their communities from the risk of things like dengue, okay? So we need to make sure that household water storage systems have lids on them so they are not going to serve as mosquito breeding grounds, okay? And that actually can serve as a breeding ground during drought times as well, like I already mentioned. And that's the kind of thing that actually keeps the different serotypes of dengue alive in the population, all right, during drought seasons. Well, that and me and you, because we're actually one of the natural reservoirs of dengue as well, okay? So like I said, we see the return of the rains, we see a return of the mosquitoes, and hence an increased risk of dengue, okay? Now, the other thing to keep in mind is that because we've already talked about this decrease in nutritional status in the population during times of droughts, okay, these are people that if we see lowered immune status, okay, and we go into a wet cycle, possibly La Nina later in 2016, these are the individuals in which we're going to see an increased risk for I mean, everyone's at risk for dengue, but these are the individuals who are going to see increased risk for morbidity and mortality. We're going to see increased severity of the break bone fever symptoms of things like dengue. Okay, so once again, that returns us back to that idea of the same populations that are at risk for nutritional status disorders during times of drought. These are the same populations that are going to be at risk for severity of dengue and other vector-borne diseases when we leave the El Nino cycle behind, when we leave the drought cycle behind, okay? We also, during times of drought, we're going to see increased immigration. That's actually, I should say emigration, okay, of populations from outlying islands. All right, where maybe their food sources have been depleted, their ability to farm has been depleted. And so what do? Well, they emigrate from those outlying islands to some of the larger islands. And with that, what do they bring? Well, they bring the different serotypes that they may have been exposed to those outlying islands, and they bring it to the main islands. Okay, if we look at a place like the Solomon Islands during the big outbreak in 2012, okay, that's what was responsible for the introduction of some of the different serotypes. So remember, there's 4 different serotypes of dengue: 1, 2, 3, 4. We were very creative when we thought of those, weren't we? So in the Solomon Islands, that's what was responsible for the introduction of different serotypes of dengue onto Guadalcanal, the large island, was the emigration of certain populations from the outer island. Not only I mean, in those instances, it wasn't drought. They weren't trying to get away from drought conditions, but they were immigrating into Guadalcanal on a daily basis for things like work and education. So if we go to a place like Chuuk, we know that right there on the main island of Chuuk, we have people that are coming in on their boats from the outer islands every day. So that's a potential way in which different serotypes can be introduced in, and that's all exacerbated during a drought cycle when people sometimes actually have to abandon their homes and their islands to seek better resources elsewhere. Okay, this is going to be our last topic, and then we'll do a quick review. Okay, there are also mental health issues associated with droughts. Now, those of you who have listened to my lectures before in the past, you know that I always talk about mental health. I consider mental health to be the red-headed stepchild of both public health and medicine. It's something that we oftentimes ignore tragically. Okay, and I also consider it one of the essentially one of the forgotten non-communicable diseases. I actually lump mental health in with things like domestic violence when I talk about non-communicable diseases. So what are what's the connection between mental health and drought? Well, essentially, it's an economic impact. Same thing again. If you've listened to my lectures, you know it's always about the economics of the issue. Okay, as we see increased pressure on livelihoods, all right, such as farmers and fishermen, people who own stores, people who work in stores, and so on and so forth, we're going to see increased anxiety, increased risk of depression, all right, and so on and so forth. Okay, so it has an economic role to play in terms of people whose livelihoods are impacted by the drought. But this in turn is also going to have an impact upon the households, upon the individuals at that local level that we serve. So as these people see a decrease in lack of access to appropriate and safe water supplies, okay, as they see lack of access to affordable foods, remember that's that issue of local affordable foods versus having to buy imported foods at the store, we're going to see an increased risk of anxiety. And with an increased risk of anxiety, we're in turn going to see an increased risk of actual depression in the populations, okay, which might be stigmatized here in the Pacific and difficult to treat, particularly with the lack of mental health resources that we have out here. The other thing that we're going to see with this, okay, with these economic pressures and anxiety and so on and so forth, is we're going to see increased alcohol consumption, and we're going to see an increased risk of domestic violence as well, okay? Where we in particular, so that tends to be more among the adults, okay, that increased risk of alcohol and increased risk of domestic violence. Who it impacts are those same at-risk populations that we talked about early in our slides. It's going to be children, it's going to be the elderly, it's going to be people that don't always have the ability to care for themselves. So when we have studies that look at the impact of drought, there's been some really good ones that looked at the impact of drought on children, and what they found is that kids living in drought situations have increased fear and feelings of loss that lead to increased risk of anxiety. And like I said, whenever we have increased risk of anxiety, we have increased risk of major depressive episodes, which are very difficult to treat. Okay, so we have this increased mental health issue that we need to be very, very much concerned about. And it's never as simple as it seems. It all ties back into the whole economics of the situation that we're dealing with, as well as the culture that we're dealing with in terms of seeking assistance for mental health issues. So there you have it. You've made it through another one of my continuing professional development lectures. I really hope you're enjoying these. I'm trying to make sure that we discuss issues that are relevant here in the Pacific, and that's why we discuss drought, since we're right now in an El Nino drought cycle. So let's just do a quick little review here. So we know that we're having below average rainfall throughout early 2016, and that's leading to the potential for nutritional disorders as well as increased salinity of water in wells, okay? Lack of access to water and all the issues that entails, as well as some of the micronutrient disorders and general malnutrition disorders that we talked about, okay? Now we know that we have a potential wetter late 2016 coming as we move from an El Nino into La Nina cycle, and that increases, like we talked about already, the potential risk for vector-borne diseases such as dengue and malaria, and so on and so forth that we need to be aware of. Okay, there's also the potential risk for landslides, mudslides, and flooding because of the issues we talked about with the impact of droughts on ecosystems. Okay, and those are all things that we need to be educating the general public about, that just because the drought is over doesn't mean the impact of the drought doesn't continue in terms of public health risks. Okay, so what are the things that we need to be doing in terms of public health professionals and medical professionals? Well, we need to monitor water access to make sure that people have sufficient access to water for both nutritional, hydration, as well as sanitation. All right, we need to educate the public about water conservation, but appropriate water conservation. Remember, we need to make sure that people seal their water tanks and make sure that the water that they consume hasn't sat there so long that it's developed mold and bacteria that can make people sick and lead to diarrheal diseases. Okay, we need to be, as public health professionals, and in particular our environmental science sections, we need to make sure that we're monitoring the salinity of wells, particularly on the low-lying outer islands. If needed, we need to be prepared to provide water and food assistance. This is a big issue. Do we have plans in place so that if we have to provide for the nutritional status of an island in which which the wells have gone bad and in which there isn't rain, and the rain has caused a lack of food supplies and they can't afford to bring food supplies in, are we ready as a government, as an organization, to provide those needs? Okay. Obviously, the education on the risk of vector-borne diseases, the risks of landslide, and so on and so on forth. Okay. And then, of course, the last one that we talked about, we need to be aware of the association between drought, all right, economic pressures, and mental health issues. And are we as an agency prepared to educate the public on those issues so that they can recognize the threats that come from economic pressures leading to domestic violence, depression, and so on and so forth? And are we as a public health as well as a medical system prepared to meet the healthcare needs of a mental health population during a drought scenario? All right, so once again, there it is. I do hope you enjoyed it. Please go and look at my YouTube page. It's full of all kinds of videos dealing with public health continuous professional development. And I want to point out, for every one of these silly little lectures that you will watch, if you will send me an email, okay, and it's brian.mangum@fnu.ac.fj, I am happy to provide you with a lovely, suitable for framing, quality certificate of professional development attesting to the fact that you've completed this lecture, and that's something that you can use for continuing education units, continuing medical education units, and so on and so forth. If you want more information on that, just use my email and get in touch with me. Otherwise, please, you're doing fabulous work out there. You're working in a resource limited setting. You're doing a heck of a job, and I'm proud of you, and I hope that I can continue to be part of public health education here in the Pacific in the future. So all the best, and I look forward to talking to you again soon.